Nutrition is so important to everyone, and we hear a lot about uh, some of the programs that are out there that do a better job of supplying nutritious food and some that don't. We're going to talk a little bit today about the Farm Bill and SNAP benefits. Carolina Schneider's joining us. She's a registered dietitian and very much involved with this. Carolina, it's good to have you with us today on the program.
Hi, Bob. Thank you so much for having me.
Yeah, tell us the background of this regarding SNAP benefits and Farm Bill and all those things.
Absolutely. So, the Farm Bill includes provisions for nutrition assistance programs such as SNAP, which stands for Supplemental Nutrition Assistance Program, which some of you may know as food stamps. That's what we used to call it. And the Farm Bill, any changes to the Farm Bill can truly affect this SNAP program, which as a consequence affects how much access people and Americans have to nutritious food. So any changes in the funding, the eligibility criteria, or even the program structure, within this farm bill, will have direct implications, on food security and the SNAP program.
Yeah, that's very important. Now, what is the status? Is this renewed every once in a while, or what's happening there on it?
Yeah, so the Farm Bill is renewed every 5 years, or it's revised every 5 years. It's up for revision now at the end of the month, end of September, so in a few weeks. And the SNAP essentially just falls under that. So what I'm here to talk to you about today, Bob, is how we can make SNAP better. So some suggestions for Congress on how we can make this program more inclusive, and improve people's health through this program.
Yeah, good. Let's talk about that. That's got to be more nutritious food, right? More vegetables, those kind of things that are included, or are they already?
Yes, so that's a great point. They are technically included. All the foods are included, from real, wholesome, healthy foods, such as fruits and vegetables, beans, etc. But also think about foods that you can purchase at a convenience store. Candy bars, chips, snacks. All of those are included as well. So I think one thing we could do to make this program a little bit better is to have more strict guidelines, to help people make better food choices. So educating, SNAP beneficiaries on how to choose the healthier options, and go for those fresh fruits and vegetables instead of the candy bar. That's definitely one thing, Bob, that we can do. Another thing that the SNAP program is currently lacking is access to vitamin supplementation. So, Bob, as a dietitian, I am the first one to tell you that, we should eat a nutritious diet and get all of our nutrients from foods. Unfortunately, I am the living proof that that is not always the case. So, some vitamins are much harder to get through food sources. One being vitamin D, which most of us Americans, about 42% of Americans, are deficient in this really important vitamin. So, I think SNAP should include access to vitamin supplementation. One really easy one that they could start with that wouldn't cost the program anything is vitamin D. That way, people at least have the choice to use their benefits for supplements like that.
Now, vitamin D is important, and it's depending upon the climate that you're in too. You can get that from being out in the sun, or at least some of it. But I think what is the requirement? Is it 5,000 units, whatever it is, something like that per day? You're supposed to be taking.
Yeah, so that's in a supplement form. So that really varies depending on, each person and how deficient they are. So when you're supplementing, we look at their blood levels of vitamin D to see how much we need to supplement and then for how long. But you're absolutely right, Bob. Sunlight is the best source of vitamin D. Your body produces vitamin D when it's in contact with the sun. But as you said, depending where you live geographically speaking, you may not have a lot of sun exposure. You may have shorter summers. Also, think about, nowadays we're all working from home or we're working from an office. I know, Bob, you're probably in a studio. We're not really spending time outdoors. And when we do, we're wearing sunscreen, right? We're told to wear sunscreen, and
Right.
minimize our sun exposure. So it really is difficult to even, get vitamin D from the sun.
Yeah, it is, and of course in the winter, and it's about no matter where you are, you're going to you're not going to get nearly as much of it as well. So uh, that's
Exactly.
very important to get that. How do you find the right supplements? I know this is a big question. How do people know they're getting the right amount and what it says on the label?
Yes, great question. The first thing you need to do is get your blood work done at least once a year with your primary care physician. Make sure they're testing your vitamin D levels. That's the first step to even see if you need a vitamin supplementation, right, in the first place. From there, you can, work with your physician to check how many units you should be taking. 5,000 is a pretty standard, I would say, number, in terms of the units. And then people can supplement it, for a variety of time depending on how much they need it. So I've seen people take 50,000 units of vitamin D just once a month. So it really
Wow.
depends on your levels, yeah, which is it's a crazy number, but for some people who are severely deficient, they need to replenish that quickly. And then, Bob, in terms of the actual vitamin, brand wise, the most important thing that you look for is that you're purchasing vitamin D3. D3 is the active form of vitamin D. It is usually from animal sources. If you're following an animal-free diet, such as a vegan diet, you can now find vitamin D3 from algae and other fungi, other type of plant sources as well, which is great.
Yeah, I'm glad you brought that up because, when people go to the store and they see vitamin D, vitamin D3, it can be, confusing because people don't know the difference. So I'm glad that you point that out because it is important to get that, I think, too,
Mhm.
with the
Absolutely.
diet.
And then yeah, Bob. And then, you work with your physician and, make sure that you work together to find that dosage that's right for you and how long you should be taking it for. And then, yeah, it is such a crucial vitamin. We need it for our immune system. We've learned that in recent years, with the pandemic, that vitamin D levels are directly associated with your chances of getting sick, respiratory infections, even cancer, some, cardiovascular disease, preterm birth, even depression, mental health issues as well are all linked to vitamin D deficiency. So, you know, I'm here today to hopefully get us to, work together to get vitamin D into SNAP so that, less fortunate Americans who don't have the financial means can use their benefits to supplement this important vitamin, for themselves and their children.
Yeah, and I wanted to just point out real quick, we have a short time left, but children should be doing this as well, should be taking this as well, right? And should that start right away or what age?
Yeah, I mean, if they are deficient, absolutely. So is getting their blood work checked with a primary care physician is very important, from an early age. And again, with the SNAP program, about 40 million Americans are relying on this. 70% of those are families with children. So yes, it does affect the kids as well, Bob. And I just wanted to mention here, if people are wondering, well, what can I do about it, right? We're even if we're not benefiting from SNAP, there's this amazing nonprofit organization called Organic and Natural Health Association. And what they've done is they've written a letter to Congress, so that, us, your listeners, and even myself, we can just essentially go to this website, allforvitamind.org. Click on the tab that says take action, and the letter populates for you. You just put your zip code and it's sent to your local Congress official. So it's actually very easy. It takes about 2 to 3 minutes to kind of help us with this push to Congress and hopefully get this into the SNAP program.
Very good. Carolina Schneider, thanks for the visit. Appreciate the time today.
Thank you for having me.